want to let everyone know that this hearing will be recorded and transcribed. Hi again, everyone. We'll get started in just a few minutes. This is the public rulemaking hearing for OAR 333-019-1010 and 1011, masking and vaccination requirements to control COVID-19 in healthcare settings. This meeting is being recorded and transcribed, and we have placed everyone on mute and disabled the chat feature for this meeting. We ask that you please remain muted until your name is called and it's your turn to speak. We also are not using video or camera options during this meeting in order to prevent bandwidth issues. If you would like to view the live captions during the show, or during the meeting, there are 3 dots, the ellipses at the top of your screen. And if you select that menu, and then you can scroll down to turn on live captions, you'll be able to see captioning in real time. And we'll go ahead and get started in just a moment or so with some further instructions. Hi, everyone. We'll go ahead and get started. I do want to let you know that this hearing is being recorded and transcribed. Everyone has been placed on mute. In order to be respectful to others attending this meeting, please remain muted until your name is called and it's your turn to speak. Due to the number of people on this call, we are not allowing the use of video in order to prevent bandwidth issues. And we also are displaying live captioning for this hearing, which you can access by selecting the 3 dots, the ellipses at the very top of the screen, and selecting the drop-down menu to turn on the live captions. My name is Brittany Hall, and I have been designated as hearing officer for this rulemaking hearing. I would now like to call this hearing to order. Let the record show that the time is approximately 2 p.m. and the date is January 24th, 2022. The purpose of this hearing is to receive testimony regarding the Oregon Health Authority Public Health Division's proposed permanent adoption of OAR 333-019-1010 and 333-019-1011, masking and vaccination requirements to control COVID-19 in healthcare settings. Under Oregon Revised Statute 183.335, temporary rules cannot be extended past 6 months. Thus, temporary OAR 333-019-1011 relating to masking requirements to control COVID-19 in healthcare settings expires on February 15th, 2022. This rule has entered into a permanent rulemaking process in order to extend its protection past February 15th, 2022. That does not mean the rule will be in place permanently. The Oregon Health Authority can rescind, repeal, or cancel a rule when it believes it is no longer necessary. I will call people to testify who have signed up in advance and informed me that they intended to present oral comments. Individuals will be called in the order in which they signed up to testify. If you did not have a chance to register to testify or receive confirmation via email that you're on the list, you may send an email now to publichealth.rules@dhsoha.state.or.us. We are taking signups until approximately 2:15 this afternoon. Please provide your full name, address, affiliation to an organization if applicable, and position. We also request we will be taking testimony at this hearing up until 5 p.m. And regardless of whether we have gotten through everyone who signed up, the hearing will close at 5 p.m. or sooner if everyone who signed up to testify has testified. Persons wishing to testify shall first state their names and that of any organization that they represent. The agency will not respond to questions during this hearing. The agency will not cross-examine or debate the material at hand. There will be no discussion about the proposed rules at this hearing. Questions posed to the agency will not be answered during this hearing. Testimony is limited to the matter at hand and must be relevant to the proposed rules. The hearing officer may exclude or limit cumulative, repetitious, or immaterial testimony. Please do not comment on the proposed adoption of permanent rules for masking and vaccine requirements in schools or the general indoor mask rule. Those rules have separate public hearings. Written testimony is encouraged. The deadline for written comments is 5 p.m. today, Monday, January 24th, 2022, according to the notice of this hearing. Comments received after the deadline will not be reviewed or considered by the division. Because of the large number of people who have signed up to speak, we will limit comments to 2 minutes, but request that you be as brief as possible. You will hear a timer go off at the 1.5 minute mark and will have 30 additional seconds to end your comments. The agency reserves the right to place someone on mute that goes significantly over the 2 minute limit in order to be fair to everyone who would like to speak. This hearing will close no later than 5 p.m. People who have requested to testify that are unable to before 5 p.m. may submit written comments up until the close of the public comment period, which again is also 5 p.m. today. This hearing is being recorded. The hearing recording and transcript will be posted to our website. And you can contact me at the Public Health Rules address in order to find out what that web address is. Please note that there are staff and leadership from the Oregon Health Authority present today to listen to the testimony and assist with today's hearing, including taking notes and assisting with the team's platform. Any staff who take on facilitation of public testimony will, throughout this hearing, state their name and organizational affiliation for the record. Finally, OHA will not tolerate any comments that involve the use of profanity or any threatening remarks and may mute any individual who uses profanity or threatening language. We ask that you are respectful of everyone who is on this call. I will use the participant list to call each participant by name to offer the opportunity to comment. Based on the number of individuals who have attended this afternoon, we will limit comments to 2 minutes. When you hear your name, your microphone will be enabled so that you can unmute yourself and provide comments. I will call the next 3 participants on the list so that you will know when your turn is coming up. We ask that you identify yourself on the call when you hear your name by raising your hand. On a computer, this can be done by clicking on the hand icon at the top of the screen in the top bar next to the red button, to the left of the red leave button. And on the phone, this can be done by pressing *5. We will enable the microphones of the next 3 participants scheduled to speak who have raised their hand to identify themselves, and then each speaker will need to unmute themselves when their name is called to provide testimony. On the phone, this will be done by pressing *6. On the computer, you can unmute yourself by pressing the microphone icon at the top of the screen. Again, please do not raise your hand if your name is not called. We do have a list of participants who have registered ahead of time to speak. We are also taking signups now. If you can email publichealth.rules@dhsoha.state.or.us to provide your name and let us know that you would like to speak today. All right, I'm now going to open up the floor for testimony, and the first 3 people we have on the list are Shireen Underwood, Debbie Rogers, and Laura Kelton. So if you could please identify yourself by raising your hand, either with the hand icon or *5 from the phone. And we will start with Shireen Underwood. We will enable your microphone and then you can unmute yourself.
Okay, can you hear me?
Yes, we can.
Okay, my name is Dr. Shireen Underwood, and I strongly oppose these mandates for healthcare workers. With all the data coming out about the amounts of death and disability from this experimental messenger RNA treatment, I am disgusted that the OHA is still wanting to coerce anyone into taking this. In totalitarian style, you are telling healthcare workers to play Russian roulette with their lives or lose their jobs. You each should be held personally accountable for each death or disability that comes from mandating these vaccines. This medical treatment almost killed my own brother. It put him into the hospital twice with pericarditis, and he had to have a needle put into his chest to drain the fluid off of his heart. He took this vaccine against his will. It was mandated to keep his job. You are asking people in this state to unwillingly take this risk, which is coercion and a Nuremberg violation. When this is properly prosecuted, each of you will be named for this violation. Dr. Toby Rogers, an actuary who investigates safety of vaccines, estimated that 117 children will die from this vaccine for every life theoretically saved. From the VAERS database, which is underreported by a factor of at least 41, they have estimated at least 150,000 US citizens have died from this vaccine. What's an acceptable level of death for you? GM was pulled into Congress and had to recall 2.6 million cars after 124 deaths. I strongly insist that you do not mandate these vaccines for healthcare workers.
Thank you. Next, we have a phone number that ends in 0951. We will enable your microphone so you can press *6 to unmute yourself and provide your testimony, please. And then next up on the list, we have Debbie Rogers, Laura Kelton, and Cyril Collier.
This is Debbie. Can you hear me?
Yes, we can.
My name is Becky Dubrassich. I'm a lifetime resident of Oregon. I oppose masking and vaccination requirements of any kind to control COVID in our healthcare settings. The people working in the healthcare industry have been exposed to COVID for close to 2 years now. I'm sure most of those caregivers have gotten COVID and have natural immunities, which are proven to be the best defense against COVID. These people have spent years studying medicine to work in the medical field. Shouldn't they know best whether or not they should be getting vaccines or wearing masks? Why is the OHA dictating what people in the medical industry should do? I would like to quote the Louisiana U.S. Western District Judge who blocked Biden's mandates for the healthcare workers. If human nature and history teach anything, it is that civil liberties face grave risk when governments proclaim indefinite states of emergency. I have listened to hours of testimonies against these proposed mandates. Not one person that I've heard testify supports them. Oregon residents do not want mask or vaccine mandates, and we certainly don't want these mandates made permanent. Thank you for having these hearings and taking the time to listen to us. Please do the right thing and stop the mandates.
Thank you. Next up to speak will be a phone number that ends in 7913. We will enable your microphone so you can unmute by pressing *6. And we have Laura Kelton, Cyril Collier, and Nicholas Anzalmo. Please identify yourself by raising your hand. That's *5 on the phone.
Can you hear me?
Yes, please go ahead.
Okay, this is Cyril Collier, and I am strongly against both the vaccine mandate and the masking. Just to give background, I have had cancer. I understand there are areas where masks make sense when you have immunocompromised people, but to make a strong mandate that says it across the board makes no sense. I have many doctor's appointments I go to weekly. Some of them make sense to have masks, some of them don't. To have a blanket mandate makes no sense whatsoever. It doesn't make sense for me when I'm going to physical therapy to try to exercise and get muscle working, to have to wear a mask that makes me where I can't breathe and can't actually do the exercise that I need to do to get better. That is just one example. When you have to wear a mask to pick up prescriptions at the pharmacy, when you have to wear a mask to do other things, it makes no sense. Please use common sense. One size does not fit all in medicine. If that was the case, we'd be robots. We're not robots. Please make sense and do away with these mandates. Thank you.
Thank you. Up next, we have Laura Kelton, Nicholas Anselmo, Rob Goodwin, and Peter Christoph. If you could please identify yourself by raising your hand. That's either *5 from the phone or the hand icon at the top of the computer screen. We'll be calling on people who have signed up to testify. If you did not have a chance to sign up, we are taking signups until about 2:15. Please email publichealth.rules@dhsoha.state.or.us to be added to the list. It looks like we have Nicholas.
I am Nicholas Anselmo. I am strongly opposed to any mandate for mask or vaccination or inoculation, whether permanent or temporary. I find it speaks volumes that even healthcare workers, professionals, are being having their rights and choices, my body, my choice, taken away from them. And it's no surprise, though, because we all know that any doctor or healthcare worker that in the past has gone out against the narrative has been attacked and has their licensing been taken away and their licenses of being able to say that they're a doctor or a medical professional, which to me is just immoral. Do the right thing.
Thank you. Next up, we will have Rob Goodwin. And in the queue, we also have Laura Kelton, Peter Christoph, Jessica Carlton, and Ann Neeland. So Rob, you can go ahead and unmute yourself and present your testimony, please.
All right, I'm Rob Goodwin, and I, with these others, stand opposed to this. And I just want to thank everybody for taking the time to come here and state their opinion. I don't have a lot to add, except that I'm very against this, and I think it's obnoxious that that we would be treated this way. And I think it's very wrong, and the OHA should really consider not doing this. And that's all I really want to say. Thanks.
All right. Up next, we'll have Jessica Carlton. And in the queue, we have Peter Christoph, Ann Nealand, Amanda Clark, and Elizabeth Cable. If you're able to identify yourself by raising your hand, it's *5 on the phone or the hand icon at the top of the screen. So Jessica Carlton, your microphone has been enabled. If you can unmute yourself and provide your testimony, please.
I would like to begin by thanking you for the opportunity to discuss my position in strong opposition to masking and vaccination requirements to control COVID in healthcare settings. My name is Jessica Carlton, and I am a licensed acupuncturist with the Oregon Medical Board and a current doctoral candidate in their DAOM program. It is the highest degree that can be given to one in my field and has a large focus on medical research. Authorities have spearheaded this pandemic response with one goal in mind: mass vaccination. And they have evaded and ignored discussions surrounding preventative care, early intervention, alternative treatments, and the superiority of natural induced immunity this entire pandemic. In my opinion, this borderlines medical negligence. The Nuremberg Code was a promise to humanity that we will never again force humans to participate in medical experimentations of any kind without voluntary consent, even if it is in the best interest of the patient or in the best interest of public health. In fact, it is precisely why informed consent is not only a fundamental cornerstone for the ethical practice of medicine, but it is our legal responsibility to uphold as healthcare practitioners. Informed consent includes a critical choice, and that choice belongs to the right of the patient and not the provider, and certainly not to an employer or governmental agency trying to assume power over the patient through the use of coercive manipulation tactics. Informed consent protects the patient and their rights, and the law clearly states a patient has the right to decline any medical intervention that they feel has potential risks that outweigh the benefits. We cannot properly inform anyone on the risks involved without long-term safety data. It also requires complete transparency on behalf of the medical community about all potential risks involved, even if those induce vaccine hesitancy and those concerned with safety. May I remind you that healthcare practitioners are also patients who share these same rights, and we are not expendable or less qualified to make decisions involving our own health, considering that we help patients make decisions regarding their own health almost daily, and we are licensed to do so. Vaccine mandates remove the right to informed consent and are completely unethical. How long will we continue to commodify healthcare at the expense of actual health? Thank you.
All right, thank you. Up next, we'll have Elizabeth Cable, please.
Yes, hello, can you hear me?
Yes, we can.
Hello, everybody. Once again, I am testifying. My name is Elizabeth Cable. I'm one of the people of the state of Oregon, out of the many who oppose OHR 333-019-1010, as well as 333-019-1011. COVID injections are deteriorating human immunity with spike protein overload to vital human organs. I want to say I am grateful to all Oregonians using freedom of speech. Soon it will come to the Second Amendment to protect our freedom of speech, and the courts will put you people where you belong and hold you accountable for your crimes against the people of Oregon. Our healthcare workers deserve to be healthy. No COVID injections for anyone. No forced injections for anyone. I'm grateful for this opportunity to speak. And again, I'm going to say goodbye now and allow more people to speak. Thank you so much, everyone, Brittany, everyone, all of you.
Thank you. Up next, we will have Amanda Clark, and we still have Laura Kelton, Peter Christoph, Ann Nealand, and Michaela Begg in the queue. If you could please identify yourself by raising your hand. It's either *5 from the phone or the hand icon at the top of the screen. So Amanda Clark, if you're able to unmute yourself, you can provide your testimony, please. Amanda Clark.
Hello, can you hear me?
Yes, we can.
Yes, my name is Amanda Clark. I am against the vaccine mandate for 2 reasons. The vaccines are failing at their purpose, but most importantly, the mandates attack our personal freedoms. There are several European studies which show that there are higher COVID infection rates with vaccinated people versus the unvaccinated. I won't discuss all of the studies, but there is one out of Germany which concluded that the vaxxed are 8.12 times more likely to be infected with Omicron than the unvaxxed. The fact that we are even having this discussion about mandating vaccines shows that they do not work. If vaccines are effective and protect someone from infection or transmission, why do we need to protect the protected from the unprotected? Also, if the vaccines are safe, why don't the manufacturers accept liability? There is a famous quote which states, if you have to be persuaded, reminded, pressured, lied to, incentivized, forced, bullied, socially shamed, guilt-tripped, threatened, punished, and criminalized, if all of this is considered necessary to gain your compliance, you can be absolutely certain that what is being promoted is not in your best interest. This isn't even about the virus anymore. This is about whether we are sovereign over our own bodies or whether we are a slave. If we don't have medical freedom, then we have lost all of our freedoms. Thank you for your time.
Thank you. Next up, we will have a phone number that ends in 7067. We will enable your microphone so you can unmute yourself by pressing *6. And in the queue, we have Laura Kelton, Peter Christoph, Ann Neeland, Michaela Begg, and Becky Dubrassich.
Hello, can you?
Yes, we can hear you.
Can you hear me?
Yes, we can hear you.
Okay, yes, hello. My name is John Cunningham. I just wanted to voice my concerns over mandating a vaccine for healthcare professionals. I think already when the system is strained with emergency responders being just taxed after almost 2 years of this pandemic, adding an additional strain on the system is unwise and it's unethical. I think it's okay as a government agency to encourage, to educate, to inform, but mandating is wrong. It's wrong because it takes an individual's responsibility of their own medical decision, and it takes that out of play. And you're forcing individuals who may who have an ethical or maybe they already have natural immunity to this virus, as many people do, and you're not even considering that. And instead you're saying this is the one way that we're going to get through this, when it's not considering all the factors. It's a unilateral approach to a problem that is multifaceted, and it's unwise to mandate it. Educate, inform, encourage, but don't mandate. That's wrong. That's all I have to say. Thank you for your time.
Thank you. Up next, we have Michaela Begg. And then in the queue, we will have Donna Lowry, Danny Ella, and Linda Houlihan. So Michaela, if you could please unmute yourself and provide your testimony. Michaela, are you able to unmute yourself and provide your testimony?
Can you hear me now?
Yes, we can.
Hi, I'm Michaela Begg, and this is how OHA stole my 33-year healthcare career and why I'm opposed. In 2016, Peter Daszak outlined the criminal conspiracy in an email to Fauci. We need to increase the public understanding of the need for public countermeasures, such as a pan-coronavirus vaccine. A key driver is the media, and the economics will follow the hype, unquote. To succeed with a plan, Daszak and Fauci would need accomplices. Kate Brown and the OHA functioned as a public relations agency and spread fear-based propaganda as though it were medical advice. This fake fear-based medical advice coerced healthcare workers into believing they were informed with valid medical information. Many volunteered or were later mandated and coerced by other lies to take an injectable bioweapon and to wear a mask, all while believing that a medical emergency existed. Many were injured and many died from this fear-based medical disinformation campaign. By definition, under U.S. Code 18, Section 2321, domestic terrorism means activities that involve acts dangerous to human life that are a violation of the criminal laws of the United States or of any state to intimidate or coerce a civilian population. We were subjected to these harms because of a medical emergency that did not exist then and does not exist now. However, an emergency was required in order to carry out the criminal conspiracy. In other words, they could not allow any treatments other than a vaccine. This is a direct quote from the FDA. For the FDA to issue an emergency use authorization, there must be no adequate, approved, and available alternative to the candidate product for diagnosing, preventing, or treating a disease or condition. To succeed with their criminal conspiracy, it was vital that Fauci and Daszak convince our governors and the public that only masks and vaccines would make us safe. This medical disinformation was personally disseminated by Deborah Birx, who propagated the medical disinformation through the OHA pharmacies and hospitals to harm us. This was and is a criminal conspiracy. Every policy that has been written under the false protection of an emergency use authorization must be immediately revoked. Unblock the medications our physicians need to treat patients instead of killing them. Thank you.
Thank you. Next up, we have Becky Dubrassich.
Hi there. Okay, so my name is Becky Dubrassich. I am an experienced ER nurse in a medium-sized urban hospital in Oregon. I'm against the mandates all around. My experience as an unvaccinated person dealing with Governor Brown's mandates last fall that all healthcare workers be vaccinated has been terrible. Nobody wants to be forced or coerced into having a medical procedure, healthcare workers included. Some of my coworkers who didn't want the COVID vaccine gave in and got it. They felt they had no other choice. It was either get the shot and provide for their families or not. I have several coworkers who took the original vaccine but do not want a booster. We see firsthand that vaccinated people get and spread COVID just as much as unvaccinated. We also see patients that come in concerned about adverse events after the vaccines. I personally have had 0 COVID shots and I haven't gotten COVID that I know of. I'm guessing I probably have immunity. And have had it from exposure in the last 2 years. We currently have a critical nursing shortage in Oregon. It's been going on since last summer. I am concerned it will be worsened if we make Governor Brown's mandates permanent. Nurses are leaving to follow the money by taking traveling jobs or moving to other states that don't have mandates. It will further worsen the nursing shortage if these mandates become permanent. I was recently told that we have 6 FEMA nurses coming to my department. I also heard a rumor that the FEMA nurses are not required to take the vaccine and that this is the start of a government takeover of healthcare. Whether that is true or not, time will tell. Congressman Dan Crenshaw from Texas is proposing the No Mandates for Healthcare Workers Act. I had been a lifelong Democrat up until recently. I now vote for freedom, bodily autonomy, and politicians who actually listen to and work for the people. I did notice that Mark Thielman, who is a current candidate for governor in Oregon, has been listening in and commenting on the last 2 OHA meetings. I've never met the guy, but he seems like someone who listens to and actually works for the people. Okay, it is past time to be done with all of this. Let people decide what is best for themselves and their families regarding masks and vaccines. Mandates are no longer needed or acceptable. Thank you.
Thank you. Up next, we will have Linda Houlihan.
Hello. Can you hear me?
Yes, we can.
Thank you. You've heard testimony on Thursday all day against these vaccines and mandates and masks. Sorry, mandates for masks and vaccines. And you heard him this morning and now you're hearing him now. So I don't need to repeat myself or repeat what other people have said, but they are all true. And for the government to mandate for healthcare workers who make health decisions for people every single day, then tell them they can't make their own health decisions is complete arrogance. And I'm totally against these rulings. So I'll leave this for the rest of the people to share their information. Thank you. Have a good day.
Thank you. Next up, we will have Donna Lowry and then Danny Ella. And in the queue is Adriana Capobianco, Richard Leroy, and Johanna Z. So go ahead, Donna, if you could please unmute yourself and provide your testimony. And for the other names that I just called, if you could please identify yourself by raising your hand, and that would be either *5 on the phone or the hand icon at the top of the screen. Go ahead, Donna, if you're able to.
All right, can you hear? Oh, wait, there we go.
Yep.
Oh, thank you.
Yeah.
Difficulty with this figuring out on Teams, muting and unmuting, but thank you for your patience. Again, when I go into a doctor's office, all I care about is there staff there to take care of me when I finally can make an appointment. When I'm in the hospital emergency room, I want to know if there is staff there that is highly qualified and trained. I don't care about their COVID status. I don't care if at the process at a point they're wearing masks. I care about is quality service. I care that there are individuals who are there to take care of us. I feel this vaccination requirement has added to the shortage of medical professionals in Oregon and especially rural Oregon. It is cutting back the quality of service. It is putting an overtaxed, overburden onto our first medical health responders. It's completely unfair to their mental and physical well-being to require this requirement. So I am highly, highly offended and opposed that Oregon is putting this mandate on all our professionals that have spent years of training and in their knowledge, and now you're questioning their ability to make choices on their own. So again, I am so offended that this is where we've come to. Thank you, and I'll give up my time.
Thank you. Next up, we will have Danny Ella.
Hello, this is Daniela. I am an Oregon resident and I absolutely oppose masking and vaccination requirements. It's very simple. Federal government, state of Oregon, OSHA, OHA do not own us. You have no rights over our bodies or our medical choices. Each nurse, doctor, and all other healthcare workers are professionals and adults, and they can make their own decisions on when to wear a mask and if the vaccines are right for them, like they always have, and they don't need you to mandate anything. The vaccine push is a crime against humanity, and stop lying about how vaccines and masks are effective ways to end the pandemic. And to remind you of the own rules that you're breaking, like I said this morning, here's an extract of ORS 431-180, title, Interference with Individual Selection of Healthcare Provider, Treatment, or Religious Practice Prohibited. Quote, nothing in this rule or any other public health law of this state shall be construed as authorizing the Oregon Health Authority or any local public health authority to interfere in any manner with an individual's choice mode of treatment. You are breaking this rule. Governor Brown and OHA, by pushing these backs and mask requirements in any setting, you are overstepping your boundaries. This is overreach and crime. And honestly, we are imagining you behind the bars if you keep pushing for this. We will tear down this organization because you're attempting to interfere with individuals' right to choose medical treatment. Lastly, extract of the Oregon Constitution, Article 1, Section 1. All power is inherent in the people, and all free governments are founded on their authority, and they have at all times a right to alter, reform, or abolish the government in such matter as they think proper. Thank you, Oregon, for standing up. Don't give up the fight. Keep fighting. And OHA, stop abusing your powers. We're watching you. Thank you.
Thank you. Next up, we have Adriana Capobianco, and then we'll have Richard Leroy, and we have Johanna Z, Catherine Gentle, and Dan Stasso in the queue. If you could please identify yourself if you hear your name by raising your hand, that's *5 on the phone or the hand icon at the top of the computer. So Adriana, please go ahead.
Hello?
Hi, go ahead, please.
All right. OHA, your behavior is insane. Your proposed rules are insane, and your leadership is completely insane. Oregon has gone off the rails of democracy and fallen down into a dark pit of medical fascism. The problem for you is that in order for this nonsense to continue, it requires ongoing compliance by the people. But we see right through you, and we know who you are. We are coming together, putting our differences aside, and standing up for freedom. We will manifest liberty for all future generations, and we can do so peacefully. We will never stop, and each day I see our movement growing. Too many of us are awake to the tyranny now. We see through this charade, and we're organizing a vast network of freedom fighters. I am so very proud of my Oregon. When it comes to vaccines, many of us would rather die than ever receive one. So go ahead and keep poking the lion. We're amidst a massive awakening, and the revolution is coming. We know you are trying to divide us with race, politics, and gender, but we see through that too. It's a divide and conquer play. And this tactic is also failing. We have a legacy in this country of standing up against tyrants and standing up for our civil rights. We, the American people, will always find a way to come together, and we will always have each other's back. This is our country, it's our land, and it is our home. We're holding the line for freedom and for all that come after us. Join the movement at freeoregon.us. Thank you.
Thank you. Next up, we will have Richard Leroy. Richard,
Can
are you
you hear me?
able? Yes, we can hear you.
As a concerned citizen of Oregon, I oppose these mask and vaccine mandates rules in healthcare settings as unconstitutional. I will not consent. I will not comply. We're not going to take it anymore. Thank you.
Thank you. Next up is a phone number that ends in 6027. We will enable your microphone so that you can press *6 to unmute yourself. And in the queue, we still have Johanna Z, Catherine Gentle, Dan Stasso, and Josephine Aquino. If you could please identify yourself by raising your hand, and that's a *5 on the phone or the hand icon at the top of the computer screen.
Hi, this is Johanna. Can you hear me?
Yes, please go ahead.
Hi, this is Johanna Z. I'm a resident of Oregon. I'm a former registered nurse and a doctor of natural hygiene. I am vehemently opposed to this proposal. There's absolutely no need. It's actually quite sad when you say that the best options we have are masking and vaccines, because there are so many other ways to keep us healthy. So we know at this point that vaccines do not prevent the spread of COVID. We know that the exemptions have been very, very difficult for people to get and are rarely given, and with great hoops to jump through just in order for someone to keep their livelihood. Healthcare workers, and this is my personal experiences from people that I know, they have been mocked and harassed for not going along with the agenda. You, OHA, among the other organizations, have created an environment of division, and this is hardly a setting for people to heal. We know that chronic mask wearing adversely affects the immune system, and again, you're clearly targeting this population, and need I say that this is a clear violation of the Nuremberg Code. And these measures are increasing the isolation of patients when they can't have an advocate with them, when visitation is either limited or not allowed. This is leading to an increase of deaths, especially when we know that the particular protocols being used, are not working. They're killing people. And with the proper treatment, no one is dying. So, thank you. I'm good.
Thank you. Next up, we have Josie. And in the queue is Catherine Gentle, Dan Stasso, Andrew Lewis, and Mark McSorley. Josie, if you could please unmute yourself and state your full name and provide your testimony.
Hello, my name is Josephine Aquino. I go by Josie. I am an unemployed registered nurse because here in our community, unvaccinated nurses are terminated, even if you're not seeing patients, and no accommodations or exemptions are being held. I submitted a religious accommodation to All Care Health, who then just terminated me because they accepted no accommodations. All of us were terminated. I would be willing to go back to work in my community. Unfortunately, Asante Healthcare Systems in Grants Pass terminated all its nurses who requested accommodation or exemption. Although I do get called from Asante because they're at a level 5 internal triage and would like nurses to come and work, I have not reapplied to Asante because they've terminated all of us. We also know that the government likes to implement mandates that they say will be reviewed or taken off the books when they no longer become necessary, but we know that doesn't happen either. As a registered nurse and previous educator, I believe I'm responsible and can make a personal choice. Stay home if I'm feeling sick and choose to not be vaccinated. And if someone offers accommodation or exemption, they should be willing to accept mine. The data is questionable on lots of the vaccination and the VAERS reports. I understand that All Care did receive some extra money depending on the number of vaccinated staff they have. And I do believe that the hospital did as well. They were incentivized to mandate this for us and terminate those of us who were unwilling to go along with this. And I would hope the Oregon Health Authority would respect personal choice on behalf of healthcare workers. Thank you.
Thank you. Next up, we have a phone number that ends in 7185. We will enable your microphone so that you can press *6 to unmute yourself. After that, we'll have Mark McSorley, and then in the queue is Andrew Lewis, Catherine Gentle, and Dan Stasso. Okay, please go ahead.
Hi, yes, this is 7185. My name is Catherine Gentle. I gave oral testimony this morning. I expressed extreme opposition to your continued violation of our civil liberties in schools, and I'm here to carry that message across to all healthcare settings. In fact, this message carries to all facets of life and living as free and sovereign beings of the living soil. Stop treating our healthcare workers and health-compromised patients as subhuman and placing them at risk. Stop all actions pursuing the passage of compulsory vaccination and masking immediately. The people have a right to choose and have chosen what keeps them healthy. Our choice will be honored. It's insanity to keep following failing and extremely harmful policies and saying, oh, maybe this time they'll work. These measures do not work. They have not worked. They will not work. You nor any arm of the executive branch and unelected officials have authority. It's your policies causing great harm. You're ignoring the red flags all around and are the cause for the healthcare crisis we face. You hold strong to vaccines and masks as the only way, denying needed health care or employment to the unvaccinated. You risk everyone's lives by bringing unlicensed or minimally qualified professionals because they took a non-approved vaccine. You deny healthy and capable, healthy workers and replace them with subpar care to those most in need. You are putting us at risk and causing the devolution and dysfunction of our once trusted health system. We, the people, and many brave souls are stepping forward to do the job that you are paid billions to do. You are failing in the most gross and negligent way. I suggest everyone go back to watch Senator Ron Johnson's second opinion panel today. You have not prioritized or made equal room for our second opinion. You must listen to us. This speaks to extreme corruption from the highest levels of our government. You know you are causing harm to your people. The good news today is that because of this Senate hearing, the FDA has finally agreed to meet with the second opinion panel of experts. Too little too late, or better late than never. Time will tell. Either way, be clear, we will not comply. Do the right thing. You've been placed on notice.
Thank you. Up next, we have Mark McSorley, and we have Dan Stasso, Andrew Lewis, Libby Gillette, and Zia Katz in the queue. If you're able to raise your hand to identify yourself by pressing *5 on the phone or the hand icon at the top of the screen, we'll be able to call on you. So go ahead, Mark, if you could please unmute yourself and provide your testimony.
My name is Mark McSorley. I broke my hand last year, and I was unable to get treatment for it because I can't wear a mask because masks trigger my PTSD, and when I have flashbacks because of it, I become violent. I have hand-to-hand and close quarters combat training. Nobody in the community is trained to protect themselves from me, and even my wife, who I love more than anything else, has actually been threatened and almost harmed by me. It's disturbing and disgusting that, you know, we're not making accommodations for that. Not only that, but when you have to sign a waiver saying that you will not sue the manufacturer of this vaccine if you have serious side effects, that's also a problem. And then, of course, you know, we have the hypoxia issues, as well as fungal and viral infections, and even skin infections that my wife and my mother are both being affected by wearing these masks all day. This is unsafe, insane, and needs to stop. Thank you.
Thank you. Next, we have a phone number that ends in 9055. We will enable your microphone so you can unmute yourself by pressing *6. And in the queue, we have Dan Stasso, Andrew Lewis, Libby Gillette, Zia Katz, and Amy Morgan. If you could please identify yourself by raising your hand, that's *5 on the phone or the hand icon at the top of the screen. So the phone number that I just called, the last 4 digits of, if you're able to unmute yourself by pressing *6, you can go ahead and provide your name and testimony.
Hi, can you hear me?
Yes.
Hi, my name is Zia Katz. I am in Eugene, Oregon. I am a health provider, a healthcare provider, true health, true care. And I just want to state my testimony for public record and private record that I adamantly oppose all of these mandates across the board, especially in healthcare settings. And I think everyone has so beautifully stated factual and experiential information that it's just blatantly obvious. We all know. OHA, you know, you see it, you understand. And not only is this just about money, it's also about control. And whenever there's lies and deceit and chaos, that is where Satan lives. And my message to you today is to take a look at that within yourself and within your organization. And please understand that Satan only has so much time on earth. And from a religious exemption perspective, this is why you guys don't want to give religious exemptions, because God is here with us. And all of us who are willing to speak out, God is here with us. And there are so many other people that would love to speak out on this, but they're just, they're not ready, or they don't feel confident. They don't feel in control because of the mandates that you have placed upon the people. And I would just like to say, Satan only has so much time on earth. So please redeem yourself. Please redeem these horrific actions that you are doing to the people. Otherwise, you will rest in the pitted realms of hell. I am complete.
Thank you. Next, we have a phone number that ends in 1981. The phone number that ends in 1981, if you're able to unmute yourself by pressing *6 and providing your name and testimony, please.
Can you hear me?
Yes.
Okay, my name is Amy Morgan. I do not agree with any of your rules. You guys need to look up Operation Lockstep. This whole thing was a pandemic to depopulate the world. Stand up and fight. Let's go, Brandon.
Thank you. Next up, we have Dan Stasso, Andrew Lewis, Libby Gillette, Rachel Najjar, Tammy Bennett, and Amy Ulch. If you could please identify yourself by raising your hand, that's *5 on the phone or the hand icon at the top of the screen. And I will take this moment to remind everyone that we are taking written comments until 5 p.m. today. Those written comments can be sent to publichealth.rules@dhs.oha.state.or.us. Rachel Najjar, we have you up next, please. We will enable your mic so you can unmute yourself and provide testimony.
Can you hear me okay?
Yes, we can.
My name is Rachel Najjar. We don't need masks or vaccines. This entire pandemic was preventable. In other countries are actually using science to help their country by giving them treatments to keep at home for free so that they can begin early treatment. Why are Americans being deceived? Listen to the doctors and do the treatment. Where is the risk-benefit analysis of this vaccine? It's negative, and you know it. This jab is killing 15 people for every person that you might save. For kids, that number is in the hundreds. Public health degrees are not medical degrees. I know this because I have 2 of them. It is time that we let the people that did the grueling work in medical school do their jobs. They are much more capable of making an informed decision about these inoculations than you, OHA. We still do not know the long-term effects of this inoculation. What if everyone dies in 18 months like the ferrets? We will have needless deaths skyrocket simply because there will be no staff, much like the situation we already seem to be in. Let doctors be doctors. This is not your call, and you will be held liable for the death of these doctors and nurses, not to mention the people that they are treating. I know people that can't get medical care because they get sick around inoculated individuals, and all medical staff are inoculated. Where there is risk, there must be choice, and continuing down this road will collapse our society. Vaccine manufacturers are not liable for damages. So guess who will be? You. This is unacceptable, and we will not tolerate this any longer. It is time that we start holding you accountable for the damage that you have done and are doing. We will not comply.
Thank you. And my apologies. If I had just called your name up, I may have provided the wrong information. It should be *5 in order to raise your hand to identify yourself. and then it will be *6 to unmute yourself once we've enabled your microphone. So next up, we have Tammy Bennett, Amy Ulch, Samantha Gibbo, Kelly Barnett, and Andra Salmon. All right, Kelly Barnett, we'll go ahead and enable your microphone so you can unmute yourself and present your testimony, please.
Hi, can you hear me?
Yes, we can.
Yes, my name is Kelly Barnett. I am a retired communicable disease and bioterrorism preparedness nurse. My current affiliation essentially is just as a whistleblower. So my statement is that twice since the inception of the Homeland Security programs, the United States Department of Defense has been sued for unlawfully experimenting on our soldiers. In 2003, they lost the case, and they're moving to trial again in September 2022 for doing the same thing. By logical extension, these defenses should extend to our civilian population, and the Biden administration intentionally withheld this information from the United States Supreme Court when it garnered the ruling to allow him to move forward with mandates in the healthcare sector. To that end, I'll remind Oregon Health Division that they have a 10th Amendment right and a moral, ethical, and a legal obligation to defend the 10th Amendment for this state and for the citizens of this state. And the PrEP Act is not being properly used by DHHS in order to give liability and immunity protections. The United States erred in providing vaccine to foreign countries under the guise that there is an approved vaccine which has been federally adjudicated that does not exist and is not in manufacture. And it's likely very important for Oregon Health Authority to know that this issue is much larger than the one we're facing intrastate, and that there are members in other countries that is eyeing how we're behaving and the response to these unapproved vaccines. Thank you.
Thank you. Next up, we have Tammy Bennett, Amy Ulch, Samantha Gibbo, Andra Salmon, Catherine Green, and Stephen Godokis. If you could please identify yourself by raising your hand. That's *5 on the phone or the hand icon at the top of the screen. Okay, go ahead, Catherine Green. We will enable your microphone so that you can unmute yourself and provide your testimony.
Thank you, Oregon Health Authority, for the opportunity to speak to this very important issue. One of the things that has disturbed me the most in the state of Oregon is the firing and abuse of all our brave healthcare workers who fought the pandemic on the front lines and probably have natural immunity to 95%. The fact that we have denied the existence of natural immunity shows corruption, collusion, and violence against the people of this nation. They are forcing a product for which no one is liable. We have no safety data for it. It is showing negative vaccine efficacy after multiple doses for preventing the latest variants of SARS-CoV-2. And it looks like it is creating more variants by training your immune system to be only able to fight the original one. The safe and effective treatments which exist in many other nations, including Japan, Mexico, and India, have made high use of and provided to their entire populations for free, stamping out COVID in literally 2 weeks' time in some cases, have been suppressed violently in this country so that you could force this product on an unwilling population. And finally, we have all-cause deaths skyrocketing in the age group 16 to 64, our working class. It is from these products. And finally, when a politician, Kate Brown, and a financier, Pat Allen, think they get to make the medical decisions for medical doctors and nurses and chiropractors and naturopaths and acupuncturists, they are wrong. They are violently wrong and they are harming people. You need to let people do their own research, make their own decisions. End of story. You are out of line. You are end run around our legislature and the population of this state. I hope that your budget is slashed to 10% and a naturopath is put in charge, and then you will see improvement in the health of Oregonians. Thank you.
Thank you. In the queue, we have Tammy Bennett, Amy Ulch, Samantha Gibbo, Andra Salmon, Stephen Godokis, Paige Cramond, Virginia Hall, and Tina Bacon. If you've heard your name, please identify yourself by raising your hand. That's *5 on the phone or the hand icon at the top of the computer screen. Virginia Hall, we will go ahead and enable your microphone so you can unmute yourself and provide your testimony.
Okay, 1 minute. I'm Virginia Hall. And it is my opinion and the result of my research that laws that enable local health departments to issue public health orders are doing unconstitutional business. Local health authorities have grown accustomed to issuing edicts and coercing compliance. It is far past time for this unconstitutional conduct to stop. The laws in question allow state health officials or local health departments to create and enforce orders to limit the spread of a disease. The law violates the state's constitution, which gives separate powers to different branches of government and says that elected officials should be the ones to issue such mandates. Whether your department can abolish representative government in the creation of public laws or not, the state health department's rules are also permitting local governments to subject Oregonians to disparate treatment by enabling a patchwork of local health orders, thus violating the Equal Protection Clause of the state's constitution. Refrain from issuing public health orders. Adults.
Thank you. Next up, we'll have Stephen Godokis. Stephen, if you're able to unmute yourself and provide your testimony, please.
Hello?
Hi, we can hear you. Go ahead, Stephen, if you could unmute yourself again, please.
Hi, Stephen Godokis. Thank you, Brittany, and everyone for speaking. You guys need to resign for the simple fact that you clearly don't pass the sniff test for the Bill of Rights. Get out and turn state's witness to Project Veritas, WikiLeaks, or someone you trust. I'm sure the people will be more forgiving now than they will in a few months from now. Uttar Pradesh, India, eradicated COVID with ivermectin. Fauci made that impossible to get in the States. As with AIDS, the AIDS pandemic, he made the simple drugs then impossible to get. Mexico City eradicated COVID with ivermectin, as hydroxychloroquine and the other quercetin families that are well-known antivirals and other also natural antivirals. Fauci is still preventing the use of these drugs, as with El Salvador, that gave all its people ivermectin in its medical kits. Free Assange, pardon Snowden and pardon Assange. Thank you very much.
Thank you. Up next, we'll have Tina Bacon. Tina, if you're able to unmute yourself, please do so and provide your testimony.
Are you able to hear me now?
Yes, we can hear you.
Okay. I'm Tina Bacon of Oregon, and I'm against these two rulings and ask that you please stop all vaccine and masking rules. Masks promote bacteria and reduce oxygen levels. Science has proven masks are ineffective. Staff and patients are living in fear because of OHA mandates to wear masks and the threat to have to go against beliefs and having a right of choice taken away to be vaccinated or not. Masks are killing patients and all. Be reminded, the recent Supreme Court ruling blocking vaccination and testing that administration has overstepped authority. I'm asking OHA to comply with this immediately for the health and welfare of the Oregon people. OHA is creating the shortage in medical staff with these mandates. Please stop. OHA is creating an unsafe healthcare environment for patients with these mandates, not COVID. Please stop. Listen to Dr. Robert Malone in his speech yesterday. He created the RNA vaccine technology. He said, these vaccines are not safe. Vaccines do not provide immunity. Natural immunity from COVID is long-lasting and highly protective. We have the right to make a choice and not be threatened or forced. Please stop. Businesses should not be enticed or encouraged by COVID money to put pressure or threaten people. Please restore our rights to govern our body and stop these mandates. That is all.
Thank you. Virginia, it was brought to my attention that we may have accidentally muted you before your time was up, before your whole 2 minutes were up. So we have enabled your microphone again if you would like to have another 30 seconds to finish your comments.
Do you have any idea where I got cut off?
I'm sorry, I don't. If you'd like to,
Great. Just
that
a
was our
minute.
mistake.
Let me see what I can do here. Okay. State Department rules, state health department rules also permit local governments to subject Oregonians to disparate treatment by enabling a patchwork of local health orders, thus violating the Equal Protection Clause of our state's constitution. Refrain from issuing public health orders. Adults have the constitutional right to privacy, which by court rulings has been interpreted to include the right to refuse medical treatments. Adults also have the protection of tort law in that any unwanted medical procedure is considered an unwanted touch or even assault or battery. Refusing medical treatments is often based in deeply held religious beliefs. The First Amendment protections of adults' rights to freely practice their religion as they see fit can prevent treatment. The U.S. Constitution safeguards the rights of Americans to privacy and personal autonomy. Although the Constitution does not explicitly provide for such rights, the U.S. Supreme Court has interpreted the Constitution that they protect these rights, specifically in the areas of marriage, procreation, abortion, private consensual homosexual activity, and medical treatment.
All right, thank you. That was an extra minute in addition to your previous time, so I'm going to have to move on. Thank you. All right, next up, we have a phone number that ends in 2526. We will enable your microphone so you can press *6 to unmute yourself and provide your name and comments. And in the queue, we still have Amy Ulch, Samantha Gabo, Andra Salmon, Paige Cramond, Christina Carmichael and Melissa Markslad.
Hello, this is Paige Kremen. Does anyone hear me?
Yes, we can hear you.
Thank you for your time and thank you for allowing me to give so much testimony. My name is Paige Crammond, and as I said this morning and Thursday morning, or afternoon actually, I oppose obligatory masking and vaccine mandates. And to avoid too much repetition, allow me to just repeat that I am a state licensed and nationally certified speech language pathologist who was fired for not complying with a vaccine mandate, even though I was working online only. Please end your misguided adherence to this bad rule. I have a neighbor who was also fired who was in the medical profession, and you're just creating more problems than you really ought to. Thank you so much. Bye.
Thank you. Next up, we will have Melissa Markslad. And then we have Christina Carmichael, and in the queue, Megan Langdon, Brittany Ruiz, and Stephanie Mulholland. So Melissa, if you're able to unmute yourself, you can provide your testimony, please.
Can you hear me now?
Yes, we can.
Okay. I am Melissa Markslad. I am an RN at a hospital in Southern Oregon and have been on leave since October 18th. I am in no way anti-vax. I actually received the first Moderna vaccine in August, independent of any mandates, after looking at the data which showed an antibody boost following a COVID infection, which I had in January of 2021. I currently have lab-confirmed antibodies. After COVID plus one dose, I am literally in the most protected cohort, much more so than the healthcare workers that are currently allowed to work with COVID because of the dire state of the healthcare systems. I am at home caught between policy and science, while patients suffer the consequences of compromised care. Medicine requires nuance. This week, the CDC put out a new report in the MMWR that states, as was observed in the present study after July, recent international studies have also demonstrated increased protection in persons with previous infection, with or without vaccination, relative to vaccination alone. This new report is the first time the CDC has acknowledged an increased level of protective immunity from previous infection and confirmation of the international data that has supported this. Science is never a one-size-fits-all approach. Prohibiting people like myself with adequate protection is contributing to staff shortages, directly impacting patient safety and outcomes. As I have said, I am not anti-vax, but I am adamant that my medical decisions are backed by data. In light of the latest CDC report, I hope Oregon is willing to pivot to allow the latest data to guide policy and lead the nation accordingly. Just today, I received an email from my hospital that is 100% vaccinated, not accepting anyone with exemptions to work. They have over 100 healthcare workers out with COVID now and have moved into contingency staffing plan while I sit home with antibodies and patient care plummets. The vaccine works for the individual, but does not prevent transmission, and therefore mandates are not logical. It is time to follow the latest science, which needs our healthcare workers back in the hospitals. Thank you.
Thank you. Next up, we will have Christina Carmichael.
Can you hear me?
Yes, we can hear you.
Hi, my name is Christina Carmichael. I'm an intensive care nurse. I work in 2 different ICUs throughout the state, and I'm calling in to oppose the vaccine mandates. Since these failed policies of vaccine mandates have been implemented, at first we were told it was to reduce the spread of COVID among healthcare workers to ensure that we could show up to work and staff, but yet the state of Oregon sent home several hundreds of healthy healthcare workers who had already had antibodies and were already immune to COVID with lifelong immunity. We're now seeing in our studies that that is actually better. I oppose these mandates because it actually created the staffing crisis as opposed to helping it. I also have a bird's eye view and audited the codes that happened in my hospital, and I was able to see that multiple people died It almost doubled starting in August when these mandates were implemented, and people die because you don't see it coming. You don't get in front of it. They have heart attacks. They have complications because your nurses were taking 5 or so or more patients. They had untrained staff. They had not volunteers, but National Guardsmen in there. Riverbend went ahead and sent home a bunch of healthy workers and then turned around and absorbed all the taxpayer money through federal grants so that they could pay $10,500 a week, further burdening our community. So these mandates have increased unemployment, they've increased poverty, they've increased suicides. Our death rates are up 40%, not due to COVID, but instead due to these vaccines. And you have healthy nurses at home sitting, waiting to be called back to work. These mandates have to stop. Governor Brown's policies expired and failed. OHA should not take up the torch. Otherwise, you will be held liable as well. We have the names of the decision makers on this board, and we will pursue legal action.
Thank you. Next up, we have Stephanie Mulholland.
Hi, my name is Stephanie Mulholland. I am a nurse and I am very strongly opposed to the vaccine mandates in the healthcare settings. Healthcare is an extremely personal matter. One of the favorite go-tos for a long time has been my body by choice, but where is that rhetoric now? Where is my choice for what is right for my body? As a nurse, I've had to watch people make decisions with their bodies that personally I may or may not agree with, but how it is their choice. Getting a vaccine should be my choice. Masking should be a personal choice. If it makes an individual feel safer, then by all means choose to mask, get the vaccine. Stop making this a war between the maskers and the anti-maskers and those pro-vaccine and the quote-unquote anti-vaxxers. Choose instead to make people responsible for their health choices and their own health care. Thank you.
Thank you. Next, we have Megan Langdon.
Hi, can you hear me?
Yes, go ahead, please.
Hi, my name is Megan Langdon. I am a healthcare worker, and I am against the permanent mask and vaccine mandates in our healthcare facilities, or in any setting for that matter. And there are many reasons to immediately stop the implementation of the mask and vaccine mandates, as so many people have explained before me, but I want to talk about the data. Let me start by asking, what do these mandates actually do to protect anyone? Have the mask and vaccine mandates done anything to mitigate the spread of COVID in Oregon? Let's look at some of the data. Here in Oregon, 74.6% of individuals above the age of 18 have completed their primary series of COVID shots, meaning they have gotten 1 J&J or 2 of the Moderna or Pfizer series. Over 85% of healthcare workers have had a complete COVID series, and 39.2% of Oregonians have had a booster dose. Since the availability of these shots and achieving the governor's goal of over 70% rate of uptake, our case rate in Oregon has gone up. It has not gone up by just a little bit either. The number of daily of coronavirus cases has gone up 904% since April of 2021. Since the reinstatement of the indoor mask mandate on August 13th, 2021, daily COVID case rates have gone up 307%. I would say, if anything, this data tells us that the mask mandates and the COVID shots are causing more cases of this disease, or at best, doing nothing at all, and we should scrap these so-called safety measures immediately. They are not working. These numbers that I got came directly from the OHA dashboard today. So why? Why would anyone be required to take any of these shots? Why would we double down on our masking requirements? Why are people losing their livelihoods and their careers? Why are people being threatened, coerced, and deceived into taking these shots and being forced to wear an ineffective face covering for hours in a day? What is the goal here? We deserve to have our voices heard and recognized. Not one measure taken by the state of Oregon has been innocent since the start of this pandemic, and the rest of the country sees this as a joke. And this insanity and the mask and vaccine mandates in their full capacity and in any setting. Thank you.
Thank you. Next up, we have a phone number that ends in 0685. And as a reminder, we have Brittany Ruiz, Sonia Feintek, and Melody Short Voice in the queue. If you could please identify yourself by raising your hand, and that's *5 on the phone or the little hand icon at the top of the screen. So the phone number that I just called, go ahead and unmute yourself with *6 and provide your name and testimony, please.
Hello, can you hear me now?
Yes, we can hear you.
Oh my gosh, I'm so sorry. I wasn't expecting to actually get on, but that is confusing sometimes. So after hearing so many testimonies of science and experiences from professionals, from experts, from moms, from dads, from citizens, business owners. I'm a business owner in Lincoln City, Oregon, and a citizen that owns a home as well. And yeah, I feel like everything that needs to be said has been said, but I would just add that I just agree with everyone, and there's a lot of us. I do want to say in my 2 minutes that I spent an hour and a half trying to figure out how to get on the meeting today. So I know there are myriads of people that are not on this meeting that could not get through the technological difficulties that I encountered today. And I was thrown out 3 times on the call. Might have been my cell phone, I don't know. Doesn't usually happen. And I'm offended that, and I think a lot of us are, that we can't have public meetings. If masks work and vaccines work, then all of you that are masked and vaxxed should be able to be in a public room with the rest of us together, because this is not fair. It's not constitutional. It is a form of censoring, as are the masks, as we all well know. And in closing, my husband was fired as a coach in the school system because he didn't want to sign the paper to adhere to the draconian measures that other people have testified about. So I hear my time is up, and I will finish up here. And we would like for him to be able to go back employed. The one last thing, during the abuse programming, the teachings that we go through, it stated that we were required to report child abuse in any way, emotional, physical, sexual, psychological. So since you're the Oregon Health Authorities, I am officially reporting child abuse in the entire public school system by every teacher, administrator, and coach who adheres and demands these mandates out of these children. Thank you.
Thank you. Could you please provide your name for the record?
Tina Puckett.
Thank you. Next up, we have a phone number that ends in 9664. All right, 9664, if you could please unmute yourself by pressing *6.
Hi, can you hear me?
Yes, we can.
Awesome. Hi, my name is Brittany Ruiz. I'm a parental rights advocate for the state of Oregon, and I am testifying specifically on this healthcare rules change. A couple of things I have not brought up before is, first of all, I want to thank all the healthcare workers that, even though they're working, they're here submitting public comment. Hats off to you, and also to Brittany and OHA for putting these together. I have stated most of my concerns via email, but I want to make them more broadly known. Is the concern I have with the actual rules as written do not accommodate the ever-changing science. So there's no clause in there that says, hey, if the study says this, we better change. So actually we are becoming a regressive state, not progressive. We are not changing with the times. We're going backwards. Separately, I don't think a lot of people know that the vaccination requirement is actually going to be permanent. There's no clause in the rules that rescinds it by OHA. It's my understanding that none of these rules will be allowed to be rescinded by the governor, by any governor, if they even do a new mandate or requirement, because it's only up to OHA to rescind. And as I said on a separate call, OHA has personal and direct financial conflicts of interest, both through funding the agency and through personal relationships from the very department that's conducting this meeting today, working directly and via email and phone call with pharmaceutical companies. That is a serious conflict of interest. And I really think we need to separate that out, and an entity not biased and not conflicted should be the one that makes those decisions. Separately, people with natural immunity are being thrown to the curb, and we need to recognize that. Every study that's come out in the last year, over 160 studies, shows that natural immunity is far more superior than the vaccination. And CDC just disclosed several times on the media that the vaccines do not prevent someone from transmitting or getting the virus. So I just wanted to encourage OHA to rethink this and make sure that we are doing everything we can to not discriminate against minorities, especially with adding fines. Thank you so much. Appreciate your time.
Thank you. Next up, we have a phone number that ends in 0685. We will enable your microphone. If you could please unmute yourself by pressing *6.
Hello.
Hi, go ahead.
Yes, my name is Tina Puckett. I'm a business owner in Lincoln City. And I just want to bring up a couple of points with OHA. First off, and even the governor and the whole government system there in Oregon, you're in gross violation of the Nuremberg Code as stated. Of course, if you're not familiar with that, you should probably. And it wasn't just for the scientists who were doing medical experimentation on humans, which is unlawful worldwide via the Nuremberg Code. But any accomplices were also included, especially the media. So I just wanted to make you aware of that, which I'm sure that you are. And we're not actually going to put up with it anymore. And it's evidenced by, and you don't really have the right to cut off testimonies. They should go as long as people. And if you're going to do that, then you need to have public meetings in person. And that way, at least you'll understand how many people are involved. Thank you and have a great day.
Thank you. Next up, we have a phone number that ends in 4293. We will enable your microphone. If you could please press *6 to unmute yourself and provide your name and testimony.
Can you hear me?
Yes, please go ahead.
Hi, so my name is Sonia Fentish. I oppose the adoption of all OHA permanent rulemaking. First off, I just want to say thank you, OHA. Thank you for opening the eyes of so many Oregonians to what happens when you have an unaccountable, unelected government entity given overreaching authority and power. Don't forget, folks, that OHA didn't even exist before 12 years ago. Thank you, OHA, for reminding us that this is what happens when our legislative body is bypassed, our democracy shattered, and our governor circumvents our natural rights as free Americans. Thank you, OHA, for making it crystal clear that we do not need or want your institutions or your authority any longer. If you restrict what businesses we use, we will simply stop using those businesses. We will engage in commerce not under your jurisdiction and without your authority. If you restrict our access to public education for our kids, we will stop going to your schools, stop funding them, and create our own schools free of your jurisdiction. If you restrict access to healthcare, employment, and hospitals for our healthcare workers to work in and for the community to go to, we will stop using them. We will create our own community healthcare. We will keep our people healthy and abandon your institutionalized medicine in favor of real health and wellness. We will not comply until you have been made irrelevant and you crumble into entropy. You have been put on notice. We do not recognize your authority, and you have no jurisdiction over us. Thank you for pushing us so hard. You have woken up people far better than I or any other activist could. You have single-handedly helped spark a medical freedom movement that you will never be able to control. Please, everyone listening, attend the Medical Freedom Rally at the Capitol February 1st, 11 a.m. to 3 p.m. I yield the rest of my time.
Thank you. Next up, we will have a number that ends in 6473. And in the queue is Melody Shortvoice, Sarah Cassidy, Chip Halverson, and Kevin Skirter or Shirter. Sorry if I'm mispronouncing names. So for the phone number that I just called, please go ahead and unmute yourself and provide your name and testimony.
Can you hear me?
Yes, we can.
Can you hear me?
Yes,
Hello?
we can hear you.
Can
Yes, we can
Oh,
hear you.
good.
Please go ahead.
All right, I had to press *6 several times. My name is Melody Shortvoice. I am an acupuncturist here in Oregon, and I oppose both the mask and vaccine mandates. I am not going to go through all of the science, nor am I going to point out the human rights violation, your medical bigotry, because of there. Others have already and will continue to do so. As for personal harm, you will get that in my written testimony. Instead, I would like to state the obvious and point out the maliciously ludicrous situation that we find ourselves in. What is one of the most dangerous things about COVID? Not being able to breathe, hypoxia. So why on earth would anyone think that it's a good idea to have a measure in place that makes it harder to breathe and causes hypoxia? Are you trying to make things worse? It certainly appears that way. I would also like to speak about the absolute lie that the unvaccinated are of any danger whatsoever to anyone. Just back in 2015, when we were stuck in the NICU with the birth of my premature son, the only child who was allowed to visit us in the NICU was a completely unvaccinated one. Why? Because it was such a solid known fact that an unvaccinated, healthy person is about as low risk a category as you can get. It was her unvaccinated status specifically that allowed that child to come visit. It's politics and agency capture and not reality that has changed that perception. Denying natural immunity negates the entire theory upon which vaccination is built. If there is no natural immunity, then what are vaccines trying to be a knockoff of? Without natural immunity, they can only be classified as a poison. I've been a practicing acupuncturist here in Oregon for 16 years. We were better off without OHA, which was founded only in 2019 as the last person, 2009 as the last person mentioned. I have already applied for and received a secondary license in another state in case I need to give up my right to practice here in my home state. I have one foot out the door. Please give me a reason to stay. Please drop all these mandates now. Thank you.
Thank you. Next on the list, we have Sarah Cassidy, Chip Halverson, Kevin Shirter, Austin Larson, and Colin Stores. If you could please identify yourself by raising your hand, and that's a *5 on the phone or the hand icon at the top of the screen. We will go ahead and go with the phone number that ends in 5378. We'll enable your microphone so you can unmute yourself by pressing *6, please. Was the number that I just called able to unmute with *6? Okay, we will move on to the phone number that ends in 9960.
Hello, can you hear me?
Yes, please go ahead.
Hi, my name is Sarah Cassidy. I'm a natural born woman of this nation. OSHA, prior to COVID, had a reasonable respiratory act and PPE protocols. These have been ignored due to politics and large amounts of money given by the federal government. My own doctors have told me that they hate masks, know that they don't work. So why are they following bad policies that they know to be wrong? OSHA should stop listening to the CDC. If they want an OSHA expert on PPE, I'd recommend that they speak to Tammy Clark and Kristen Megan, who are court-certified OSHA experts. They should also look into the numerous Freedom of Information requests around the world that have requested a proper isolated virus of COVID, and so far have not been presented with one. Vaccines are not the only way to health. They never have been, they don't work, and they never will work. And my final say, these policies have been the horridness of women delivering. Women have been forced to deliver in masks in some hospitals. This is ludicrous, uncaring, and cruel, not to mention reckless. Women's babies have been taken away from them because they supposedly have COVID, which is also cruel and uncaring and reckless. Leche, a major nation for breastfeeding mothers, talks about the importance of having babies next to their mothers in those first few minutes. Having your baby taken away because of supposed illness, even it's ludicrous. It doesn't make any sense whatsoever. These are bad policies and they need to stop. We are causing harm to our next generation. Thank you for your time. Please stop this madness.
Thank you. Up next, we have Amy Ulch. We will go ahead and enable your microphone so you can unmute yourself and provide testimony, please.
Hello, can you hear me?
Yes, we can.
Okay, hello. Sorry, I just got on here, so I don't really have anything prepared. I just wanted to speak out once again and say that I absolutely oppose these mandates for vaccination requirements, even for healthcare workers. These vaccines are experimental. There is no long-term studies that show what these vaccines will end up doing to people. And my question is, what are we going to do if everybody in healthcare who is forced to get these vaccines, what if it makes them sick? What are we going to do without our healthcare workforce if they all become sick from the vaccine? This country has always been about personal choice and rights, and they had to change the definition of vaccine to include this gene therapy. So it's completely experimental. There's no long-term studies on it. And I don't think, and especially since most healthcare workers at this point have caught COVID. They've already caught it. So they have the natural antibodies already. They don't need antibodies from the vaccine. Because again, if we're talking about science, then natural antibodies should count just as much as antibodies from the vaccine. And I don't know if anybody also was paying attention to what happened in Washington, D.C. yesterday. There was a huge march on Washington, D.C., which included many doctors and nurses that are now coming forth and speaking out because they don't agree with it. They believe in personal choice. They don't believe they should be mandated. And they were speaking at the Capitol yesterday, and the Oregon Health Authority should be paying attention to that as well. Thank you.
Thank you. Next, we have Kevin. Your microphone has been enabled. If you're able to unmute yourself and provide your testimony, please. Kevin, if you're able to unmute to provide your testimony, please do so. And in the queue, we still have Chip Halverson, Austin Larson, Colin Storrs. If you could please identify yourself by raising your hand. That's *5 on the phone or the hand icon at the top of the screen. I'm also going to go back up to the top of the list in case anybody from up at the top that we missed was able to join. We have Laura Kelton, Peter Christoph, Ann Neeland, Dan Stasso, Andrew Lewis, and Libby Gillette. So Kevin, please go ahead if you're able to unmute yourself. Okay, I'll come back to Kevin. We have a phone number that ends in 9960.
Yeah, can you hear me?
Yes, please provide your name and your testimony. Thank you.
Yeah, my name is Thor, Byron State. This is kind of a crazy thing for my channel, the mandate for vaccines on victims and healthcare workers, in the sense that if you national immunity really should be mandated to the vaccine after that.
I'm sorry to
The
interrupt
line
you. The connection is pretty poor and we're having a hard time hearing.
Yeah, I don't know how to put this in. I have full bar. Can you hear me now?
Okay. Okay, go ahead.
Can you hear me okay? I don't think you can hear me.
It's still breaking up quite a bit.
But look, if you can hear me, it doesn't matter. Everyone else is already excited right now. You guys can get rid of these mandates. Thank you.
Thank you. I'm going to go back up to Kevin. Are you able to unmute yourself? We've enabled your microphone. All right, and we have Chip Halverson, Austin Larson, Colin Storrs, Laura Kelton, Peter Christoph, Ann Neeland, Dan Stasso, Andrew Lewis, Libby Gillette, Tammy Bennett, Samantha Gibbo, Andress Salmon. If any of those individuals are on the line, please identify yourself by raising your hand. That's *5 on the phone or the hand icon at the top of the screen. At this point, since we did say we would, we have a phone number that ends in 4613. We'll go ahead and enable your microphone. If you could unmute yourself with *6 to provide your name and testimony, please.
Can you hear me?
Yes, we can. Go ahead.
Yeah, my name's Austin Larson, and I'm just calling to voice my opposition to this and the fact that nobody has been given informed consent from the beginning. We were told that these vaccines prevented us from spreading COVID. That is very clearly not the case. Everybody that got the vaccine or forced or coerced into getting the vaccine the first time has now seen that, and they will not be mandated into getting another one. A lot of people, if this is mandated, the mask is one thing and the vaccines is another, a lot of people will quit their jobs. Many people do not want their boosters, and this will collapse the hospital system as staffing is already in crisis. Is this why Kate Brown put the National Guard seat in the door? And that's all I have to say, except for you do your own research, you will find that all mRNA vaccines in the past killed all the animals. So, thank you.
Thank you. And at this time, I'd like to ask Kevin again if you're able to unmute yourself. We have enabled your microphone.
Hey, Brittany, can you hear me?
Yes.
Sorry about that. I couldn't get it to unmute. Everybody else has said pretty much what I wanted to say, but I'll just say that I've been a firefighter for 14 years. I've worked through this whole pandemic without taking time off or getting sick. I always thought the biggest threat to my livelihood was falling through a roof or burning up in a house or getting hit by a car in an accident scene. But I'd have to say so far, the biggest threat to my livelihood, my job, has been the bureaucrats and the governor of the state, which is an incredible thing to say that I've had to work through this and then also worry about the stupidity of what's coming out of Salem. This mandate is unnecessary, it's unconstitutional, and there is no reason to go forward with it. I'd encourage you to just drop it. Thank you.
Thank you. Could you please provide your full name for the record?
Kevin Schurter.
Great, thank you. We have a phone number that ends in 3757. Please unmute yourself with *6 and provide your name and testimony.
Can you hear me?
Yes, go ahead, please.
Okay. My name is Michelle McConnell, and the gross human rights violations that have taken place in the name of COVID have been well addressed in all the public commentary, as well as during Senator Johnson's panel discussion of vaccines, which I highly encourage everyone to listen to themselves and share with family and friends. I want to focus on one of the many consequences that vaccine mandates have had for healthcare workers. I'm a nurse of 10 years with acute care experience. Prior to the mandate, I had worked on a nursing unit in the hospital with a major hospital in the Portland Metro for over 8 years. Our unit manager notified staff in a meeting a couple of weeks before the mandate went into effect at the end of September that our nurse-to-patient ratio would be increasing because of staffing issues exacerbated by the mandate. Our unit changed the nurse-to-patient ratio from 1 to 4 to 1 to 5. Any increase in nurse-to-patient ratios adversely impacts patient care. This is a well-researched and documented fact. Research has shown this increases the risk of a sentinel event and negatively impacts measurable nursing outcomes such as catheter-related infections, hospital-acquired pneumonia, injury from falls, pressure ulcers, and the length of hospital stay. When hospitals state that the mandate has made hospitals safer places to give and receive care, they are grossly misleading the public, patients, and the communities they serve. We are suffering from a national workforce shortage, which has and will be further exacerbated as more employers require the vaccine for employment. From the nursing mandate, the vacancies that are now being filled by traveling nurses who make 3 times what a regular nurse makes. These lucrative nursing contracts are subsidized by federal monies that are received when an employer states they're experiencing staffing shortages due to COVID. How will the state of Oregon recruit and retain healthcare staff when these federal subsidies have dried up and experienced healthcare workers have already left the profession? Or, as Oregon Judge Michael Simon suggested, move to another state? This will have long-lasting, devastating impacts on Oregon's healthcare at a time when we are needed the most, as baby boomers, the largest generation of our time, enters the age when they will need medical care the most. Everyone loses. As time goes on, the veil will continue to lift to reveal that the vaccine mandate has caused significant damage to Oregon's healthcare. Unfortunately, the communities of Oregon will realize this after it is too late due to the corrupt government bodies and media who censor the truth. It is never too late.
Thank you. We're at the 2 minutes, so we're going to have to move on. Thank you. Okay, I'm going to put out one last call for people that we have on the list that we haven't heard from. Chip Halverson, Colin Storrs, Laura Kelton, Peter Christoph, Ann Neeland, Dan Stasso, Andrew Lewis, Libby Gillette, Tammy Bennett, Samantha Gibbo, and Andra Salmon. We have a phone number here that ends in 9960. We will enable your microphone so you can press *6 to unmute yourself and provide your name and testimony, please.
Hello, can you hear me?
Yes, we can.
Okay, wonderful. So I'm a PA in the community, working here for a long time. they got to get rid of this mandate for vaccines. You're taking people who have natural immunity off the line, and it's making it harder to work and treat patients. Secondary to that, we know it doesn't stop transmission at this point. So, you guys have to revisit this issue. Look, I understand the value of vaccines on an individual level. If you're old and sick, or you have a lot of comorbidities or immunocompromised, you should probably strongly consider getting it. But as far as people who have already had it, who are just trying to work and provide care, you guys have got to revisit this. As far as masks go, I'm not going to even wade into this at all, except to say that the powers that be, like Kate Brown, have been found in D.C. not wearing them when they're just hobnobbing with their friends. So what does it make you think about when the same people make a misdemeanor to leave your house in March of 2020? These people are duplicitous, and they don't seem to have any ability to consistent. The other thing is, if this is an issue as important as it is, and it seems to be with so many people showing up, it needs to be kicked back to the Oregon legislature. Let the representatives make the decision, not unelected bureaucrats. The OHA is free to advise the legislative body of the state, but we elect people for a reason, for representation. You need to take our opinions into account. It needs to be kicked back to the legislature. They need to make a decision on this. This can't be made in an ivory tower with no one's input, or at least if you take input, the next day you say, yeah, we're not going to do anything about it anyway. So please get rid of these mandates. Thank you.
Thank you. Could you please provide your name for the record? All right, next up, we'll have a phone number that ends in 1449. Please unmute yourself by pressing *6. Provide your name and testimony.
Hi there.
Yes, we can hear you.
Hello, can you hear me?
Yes, we can hear you.
Thank you, Brittany. I just want to thank you for giving me the opportunity to submit this testimony and make public comments. My name is Dr. Brenda McCool. I'm a naturopathic physician here in Oregon. I am absolutely opposed to both the mask mandate and the vaccine mandate for all healthcare workers and just citizens in general. I just want to make everyone aware, and including to reiterate this to OHA, that when the pandemic hit early on, before we had a vaccine, before we had any therapeutics available, naturopathic doctors were working. We were working with our patients to make a difference and keep them healthy and do preventive measures that we do in terms of treating all cold and flu seasons and treating the individuals in front of us with therapeutics that work. We were silenced by the Federal Trade Commission and the Department of Justice here locally. There was a rule put in place to silence us and put a gag order on us. Many of us were investigated for simply being doctors. This is wrong on every level. I mean, self-care, prevention, what we do as physicians, we make a difference in this state. We make a difference in this country. So I am asking OHA and all the powers that be, our legislative powers, to let doctors be doctors. Let us keep people healthy. Let us treat people and not necessarily treat the illness, but treat people and keep them out of the hospitals. That is the answer to this pandemic. It is not mandates. It is not masks, and it is not vaccines. Neither of those work. Thank you.
Thank you. All right, we have made it to the end of the list of those that have signed up ahead of time. So if there's anybody on the call that would like to provide testimony, we ask that you raise your hand at this time, and that's *5 if you're on the phone, or you can use the hand icon at the top of the screen. All right, we have a phone number that ends in 6940. We will enable your microphone so you can unmute yourself by pressing *6. Please provide your full name and testimony. Okay, I'm going to move on to Jessica Carlton.
Hi, I would just like an opportunity to finish since we were initially promised 3 minutes to speak and that time was cut short and now we have additional time. Would that be okay?
I'm sure, go ahead.
So I just had some additional thoughts involving informed consent. And I just want to say that informed consent also directly involves the patient and their care, preserves bodily autonomy, personal power, and agency, and it's used to build trust between the patient and the provider. And when you remove a patient's agency in their care, you damage their trust in you, period. And when you lack transparency, you fracture trust. And when you enforce policies that lack logic, like allowing COVID positive healthcare workers to work while unvaxxed healthy workers sit at home, you destroy trust and only prove that this was never about public health, but always about profit over people. And like I said, I remind you that healthcare providers are also first and foremost patients. Vaccine mandates remove the right to informed consent and are completely unethical. They are also proving globally to be ineffective, cause harm, and potentiate further division amongst our already fractured communities. When we learn more and we know better, we are obligated to be transparent with that knowledge and then do better with it. How long will we continue to commodify healthcare at the expense of actual health? And when will we begin to hold these pharmaceutical companies proven to knowingly produce harm, but are currently immune to liability in cases of these vaccines, not only financially liable, but also criminally responsible? Thank you.
Thank you. Next on the list, we have Elizabeth Leondar. Elizabeth, if you are able to unmute yourself, you may present testimony, please.
Okay, can you hear me?
Yes, we can.
Okay, perfect. So I would like to say I'm a ER nurse, been on the front lines of the pandemic for the last 2 years, and I am vehemently against mandating the COVID vaccine and continuing with masking in healthcare settings. Many people have already testified to how these vaccines don't really work, and the full safety data is not going to be available until 2023. And furthermore, the insane vaccine mandates have created a severe nursing shortage, something that I am working through currently, and will only cause more patients to die since there are not going to be nurses available to care for them. It's been 2 years of wearing masks. It's personally given me brain fog and fatigue, and those are two things that can be very dangerous for a practicing ER nurse. My job is hard enough without struggling to breathe through a disgusting, ineffective mask. 2 years of mandates have done nothing to stop the spread of COVID. It has only delayed it. And as this is being shown in the ERs, as we are now being overrun with COVID positive patients. But now there's even fewer staff available to treat patients because of your idiotic and insane vaccine and mask mandates. We will not comply, and if you continue with this nonsense, I will join the ranks of thousands of others that have already left Oregon for greener and less restrictive pastures. Thanks.
Thank you. Next up, we have Rich Swingle.
Hi, thank you so much. Brittany, I just have to say, I've been on all three of these. I've missed about 3.5 hours, but I have to say you have kept a very good attitude, and I just want to say that I appreciate that. Can I ask, has a single person yet, because again, I've missed 3.5 hours, has a single person spoken for the mandates?
I haven't heard oral testimony for the mandates, but we have received quite a few written comments that are for them.
Interesting. Okay, fair enough. I would like to pick up where I left off on the 20th. I ran out of time, and I was talking about, well, let me say one thing first, because between then and now, I discovered that in the Project Veritas documents that were uncovered, that the gain of function that was being done to create the coronavirus included putting masks on civets to be certain that they could, that's a mammal in Asia, they wanted to be certain that they could catch the virus while wearing a mask. So that just tells you how useless the masks are. Thing is, getting back to the pardon me, finding this in my notes. This is the fact that 90% of media in the U.S. is controlled by 6 corporations. And just wanted to read a few quotes from some scientists who are coming out. Bottom line, I'm sorry I'm out of time, but they're basically saying this was forced. They were forcing fear. They were turning people to take these vaccines. The virus is invented so that the vaccines were already in the works. The virus was basically invented so that people would take their vaccine that was already in the works. Thank you for your time.
Thank you. I see that we have Mark McSorley.
Yeah, I wanted to add to what I was saying earlier because I kept my time short.
Yeah, we will allow an additional minute for those that have already spoken.
Okay, so my name is Mark McSorley, and I forgot to include that some children that have been getting these vaccines have ended up, I can't remember the name of the infection or what it is, but it ended up that their hearts became enlarged. And once you would have an enlarged heart, your life is pretty much gonna be screwed. You can't join the military, you can't become law enforcement, can't become a professional athlete or even Olympian. So all these kids that have these goals for their futures are shot. And I mean, why? Why are we doing this? We shouldn't be pushing this. We should be able to choose. When it comes to abortion, people say, oh, well, it's my body, my choice. And again, this is more tyranny and Nazi party behavior than it is that of a constitutional republic, which is how the United States was founded. Thank you.
Thank you. I see that we have Kelly Barnett on the list again.
Hi, can you hear me?
Yes.
I was just curious if Oregon Health Division is aware of the stated military purpose for forcing the vaccinations, or that the United States Security Council, who's over top of our national incident management system, made clear statement and declaration of using mRNA and mod RNA as a biological platform, and that the military contractors, Pfizer and Moderna, have overcome the last challenges for using these as biological weapons, which is allowing the United States Department of Defense and the U.S. Army to repatriate facilities that had been only in Kazakhstan or in China or other areas. And if you have any reservations about forcing and creating a mechanism to allow mandates under these purposes. That's it.
All right, we aren't taking questions at this hearing. It's just for the purpose of taking public comment on the proposed rules. The next person we have on the list is Emil. Emil, if you're able to unmute yourself, please provide your full name and testimony.
Yes, my name is Avril Bedushana. Can you hear me?
Yes.
Okay. Having worked in the medical field for many years, I have been witness to how pharmaceutical companies wine and dine doctors and hospital staff with the understanding that their company's products will take precedent. It never felt good to me that money was being spent this way and that our department would take advantage of this. There would be staff meetings where we were coached how to treat patients without insurance or how to bill in a way that best served the hospital. Several times I left those meetings stating my disgust that a hospital would take this stance. I'm disgusted that a hospital would work for profit at all, actually. Human health care should not be about profit. It should be about human care, and the decency and the profit made should pay back into the system in a circular, balanced way. This is just a small example of how pharmaceutical and insurance companies deeply influence medical practice. Fast forward to having my own children. When my son was 2, he had his regular vaccinations per our well baby visit. The very next day, he stopped talking and he became sensitive to sound and touch. When we tried to find out what had happened, we were met with deaf ears. We spent the next several years looking for ways to help him. It was heartbreaking, expensive, slow uphill battle, as insurance companies would not pay for these interventions. And we have what one would think is good insurance. He was enrolled in Head Start. He started kindergarten with an IEP, which he had for several years, only to be pushed off it as soon as the school district could manage. I have spent a lot of time with my son helping with his sensitivities, and he is doing well despite these systems operating in a way that serves the system more than the people that these systems were created for. All of this was happening before these mandates. And now my husband, who has worked in the medical field for more than 20 years, who has been accepted for his religious exemption for all those 20 years, is now being put out of a job, and our family is being put at risk of our livelihood. I think that the medical field has been going in the wrong direction, and these mandates need to stop.
Thank you. We have a phone number that ends in 0716. We will enable your microphone. If you could please unmute yourself by pressing *6 and provide your full name and testimony. If the phone number that I just called could please go ahead. Okay, I'm going to move on to Melissa Marks-Ladd again. Melissa Marks-Ladd, if you're able to unmute yourself.
Hi, sorry. There's a delay, so I try to unmute and it takes a while. I just wanted to add to my testimony that as a healthcare worker in the hospital, we think that we can hire travelers to replace home nurses. But what happens is the travelers are not adequately trained on the floors to replace the nurses, and mistakes happen, and they happen a lot. And as a nurse on a home floor, I know the doctors, I know the policies and procedures so well. And these travelers come in from different hospitals or different areas around the country and do not know how to work, do not know our policies and procedures. And they take out catheters too early. They are not, they don't know how to safely care for our patients. And it really detracts from care, and it diminishes care, and it puts patients at risk. Additionally, people think that the National Guard coming in is helpful, but they're handing out food trays. They are not nurses. They're not taking care of patients. And we really need nurses that live and work at their hospital, who are invested in the hospital, invested in the patients in their community, to be at the hospitals. That provides the safest care for our patients.
Thank you. All right, I'm going to move back to the phone number that ends in 0716. If you're able to unmute yourself by pressing *6, please go ahead and provide your full name and testimony.
Yes, hello. This is Amelia I'm from Beaverton, Oregon. I work in high tech, and I am strongly against the mandates for the healthcare workers, against vaccinations and also masking. These products are all released under emergency use authorization and thereby cannot be mandated under federal law and per the Supreme Court. And that is not a final decision by the Supreme Court. That is still being done. So that is not yet effective. The vaccines are failing. They don't prevent transmission, and they cannot stop it from infecting others. I have a friend who works in the clinic, and those who are vaccinated and boosted are still getting COVID-19 and able to work when they test positive. Meanwhile, those who are qualified, unvaccinated, and have natural immunity are unable to work. This is absolutely outrageous. Please listen to all the nurses and healthcare workers who have testified today. Also today, there was testimony in the U.S. Congress at a roundtable by Senator Ron Johnson, and this revealed whistleblowers in the Department of Defense looking at the U.S. military saw that once the vaccination for COVID-19 was mandated on our military, they saw a 300% increase in miscarriages, a 300% increase in cancer, and a 1,000% increase in neurological diseases. That was 83,000 per year, up to 860,000 neurological conditions that were caused to military, our youth, because of these vaccines. This must be stopped absolutely immediately. Thank you.
Thank you. Next, we have Gabriel Buehler. Gabriel Buehler, we've enabled your microphone if you're able to unmute yourself and provide your testimony. All right, I no longer see his hand up. Is there anybody else? This is the last call for anyone else on the line that would like to provide testimony. Oh, I see Gabriel Buehler, you have your hand back up. Okay, we will enable your microphone. If you could please unmute yourself and provide your name and testimony.
My name is Gabriel Buehler. I really feel like the OHA is creating this whole entire problem that they're having a hearing about now, trying to decide whether or not vaccination is something that needs to be mandatory. And, you know, Oregon has a law where you don't have to get a vaccine. We're one of the only states that has that law for healthcare professionals. But you guys seem to not want to follow the rules or make up the rules as you're going along. I mean, if it was truly a pandemic and truly such a big problem, why would you have to mandate the vaccine? It just doesn't make any sense. You just want to force people. You know, I was forced to get that shot, which I wouldn't take it. I worked for Portland Public Schools. They fired me because I wouldn't take it. They told me that they didn't believe that I believed in God when I asked for a religious exemption. And the amount of healthcare workers that believe in God that have been fired because of your mandates, this isn't a pandemic. This is you guys trying to flush out all the people that don't agree with your propaganda. It's plain and simple. The writing's on the wall. We know what you're doing, and we're going to stop you. Thank you.
Thank you. I'm going to move now to a phone number that ends in 6940. If you could please unmute yourself by pressing *6 and provide your name and testimony. Phone number ending in 6940. All right, I'm going to move back to Josie. Josie, are you able to unmute yourself and provide additional testimony?
Yes, the light just came on for me to unmute. I want to thank all the people who provided data and listened outside the box. And I truly do believe it's a spiritual war as well when religious accommodations are not being accepted by employers because we're unvaccinated. I did start on the E unit at Asante, which was the COVID unit, and I believe I have natural immunity through contact and working there. And it's spiritually hurtful when people don't accept your religious accommodations. So it is truly in the healthcare looking like a spiritual battle when you're coercing us to get vaccinated or not work. That's so I want to thank those who testified and gave the data on being unvaccinated because it supports a reason for not getting vaccinated as well. Thank you.
Thank you. I'm going to move on to a phone number that ends in 6940. If the person with the phone number that ends in 6940 would like to testify, please unmute yourself and provide your name and testimony.
Hello, can you hear me?
Yes, we can
Hello,
hear you.
can you hear me?
Yes.
Okay, awesome. Yes. Yeah, thank you. Sorry, that wasn't easy. So my name is Rosie Tassa. I live in Hillsboro, Oregon, and I don't agree with the mask and vaccine mandate. And I'm just coming as a concerned mom with the mask mandate. I homeschool my girls, my 2 girls now, and I worry about speech delay and developmental delay. I can't get through a homeschool language arts lesson with my 5-year-old without saying, look at my lips. And this is how we make a lazy sound and a long vowel sound. So I'm just coming from, coming at you from a mother's perspective. The mask should totally be a choice, especially in schools. I think we're doing more harm actually when we mask everybody, because people who are actually at high risk can choose to can possibly get a hold of N95 masks to protect themselves. And when we mask everybody, we take that opportunity for them to purchase those high quality masks away. So thank you for listening, and thank you everybody who has provided a testimony.
Thank you. I'm going to put out one last call for anyone who wants to provide testimony on the mask and vaccine requirements specific to healthcare settings only. In order to raise your hand, it's *5 from your phone. We have a phone number that ends in 0685. You can go ahead and unmute yourself by pressing *6.
Hi. This is Tina Puckett. Can you hear me?
Yes, we can hear you.
Okay. Could I have that 1 minute that you were giving other people that testified earlier?
Yes.
Thank you. I just had brought to mind the mask mandate, the vaccination mandate in the medical, in the hospital. And it's one of the bases that you're using as a reason for continuing with this is because of the massive hospitalizations that you have in numbers on your website, the deaths, the cases, the positive cases. And I just wanted to address a problem nationwide, and that is that Dr. Fauci has mandated every doctor, every hospital to use a mandated protocol for the treatment of COVID-19, which is remdesivir, which is a drug that was used in Africa. They did trials back when there was Ebola, And I do believe it was more than this, but I couldn't find it on CDC website, that at least 22% of the people tested with remdesivir developed kidney issues within 3 to 5 days, some renal failure.
Okay,
So in the
thank
hospital,
you. That's been the additional minute, so I'm going to move on. We have Michaela.
Hi, it's Michaela. Can you hear me yet?
Yes.
Okay, good. I just wanted to add one other point that I wasn't able to finish with, that the way that we captured vaccinated versus unvaccinated numbers. So there was a bit of trickery that happened with that all of the reported unvaccinated cases were people who had had either one vaccine or 2 plus 14 days if they had both Moderna and either Moderna or Pfizer, or the 1 plus 14 days if they had Johnson & Johnson. So in effect, what they did for the community was they masqueraded any potential vaccine events and called them unvaccinated, and then disseminated that information for the public and pushed it really hard on the healthcare workers. We actually received daily reports with those numbers on them instead of actually giving us the categories that would have been correct, as far as people who had actually not had a vaccine, and then those that had had a vaccine but less than the 14 days, and those that were, by their definition, fully vaccinated. Thank you.
Thank you. Next up is a phone number that ends in 7350.
Hello.
Hi.
Oh, hello. My name is Leif Jocelyn. I appreciate you taking the call. Can you tell me if the board members are present? Have they been present at all today?
We're actually not taking questions at this hearing. It's just to take public comment on the proposed rules.
Yeah, that's just been a sort of a strange rumor. I was thinking, like, who needs the book of Revelation when all one needs to do is to listen to all these testimonies today? It's been really impressive, and a chorus denouncing these mandates. Just one detail on the breakthrough cases. I've been following that for the past several months, and they've been averaging 30%. At the turn of the year, they were over 40%. So any illusion about eradicating COVID-19 with vaccine mandates is wishful thinking. It's sort of like the horse is out of the barn and you want to whip a dead cat. I'm wondering about where this is going to go. I feel like last year was no hijab, no service. This year it's no jab, no job, and next year it's no jab, no food. And I guess the main thing I want to share is it really feels like the far greater threat to us at this point is these kinds of rules that are trampling on our informed consent, a right to liberties. And I'd read somewhere that the Revolutionary War, during the Revolutionary War, there were outbreaks of malaria and smallpox, but nowhere in the Constitution or the Bill of Rights is there any language about extraordinary measures in case there's an outbreak. And I think they understood that our rights are more important, even if there's outbreaks as severe as smallpox. So thank you.
Thank you. We have Kim Rice on the list.
Yes, this is Kimberly Rice. Can you hear me?
Yes, I'm sorry. I keep saying Kim. That's how your name is showing up on here.
Oh, no, that's okay.
We can give you one more minute.
That's all right. I was just stating my full name, but I do go by Kim. Thank you for allowing me to let you know that I oppose masks and vaccinations for healthcare settings. I just want to know that when I go to the doctor, that I don't have to be exposed to somebody who might be transmitting something, I recognize that healthcare workers, by and large, have natural immunity, and unfortunately, I know many of those people who lost their jobs. Just like teachers, we need our healthcare workers right now. We need our teachers right now. I feel like these things are being done intentionally to break the system. And it really hurts me to see all of the harm that's happening to people. So please, I'm opposing these rules 333, 019, 1010, and 1011, and please stop the rules now. Thank you.
Thank you. I'm going to move down to a phone number that ends in 1165. If you could please unmute yourself by pressing *6 and provide your full name and testimony.
Hello, my name is Patricia Free. I would like to say that I believe that masks and SARS-CoV-2 vaccines should not be required for staff or others in healthcare settings. Have you ever been to see a doctor? Have you ever had tests done to find out if you have cancer? Have you ever had surgery, an MRI, an abortion? What about an accident that put you in the hospital for an undetermined amount of time? These examples are all potentially extremely stressful situations, and each person handles these types of circumstances differently. I personally have had deep trauma in my life associated with more than one of these examples. Once, when I underwent a necessary, seemingly mundane procedure, it was very difficult to control my stress and anxiety. Breathing was difficult, and I grew hotter and hotter. On this particular occasion, I actually had to have a friend go with me for moral support. At one point, she even had to answer the technician's questions on my behalf because my situation, I was doing so bad I couldn't talk. I cannot imagine being in that situation today where my breathing would be stifled even more because of a mask. I cannot imagine being able to not being able to see the reassuring face of the technician. I cannot imagine the absence of my friend's kind face as she held me up, never mind the fact that you could not have your friend go with you in the first place today. I believe that the comfort of facial interaction during life's most challenging experience is cold at best. Supporting this rule is a blatant disrespect of all people, and I am appreciative of everybody who has made themselves vulnerable and shared these last few days. Thank you.
Thank you. Next, we're going to move on to Timothy Jones. Timothy Jones, if you're able to unmute yourself, please provide your name and testimony. Okay, and I'll go back to Catherine Green.
Okay, can you hear me now?
Yes.
Okay, you finally allowed me to unmute myself. I would like to give you some interesting, new, additional information that is just coming out. We have heard the concerns from various top scientists, Gert van den Bosch being one of them, about the possibility of these mRNA injections causing ADE. This is antibody-dependent immune enhancement, but not in a good way. It's in a way that can kill the person who has received the injection or the animal. Right now, the world's most mRNA vaccinated countries have shockingly high COVID infection rates. Hospitalizations and deaths are rising fast too. The mRNA experiment needs to stop immediately. Something is rotten in Denmark and Australia and Israel, where nearly 1% of the entire population just tested positive for COVID. not in a month or a week, in one day. You need to understand this is an experiment and it needs to end.
All right, thank you. That was your additional minute. I'm going to go back to Timothy Jones because I don't believe he's had a chance to speak yet. Timothy, your mic is enabled if you would like to unmute yourself and provide your name and testimony. And we have Mel. Mel, your mic has been enabled if you're able to unmute yourself and provide your testimony. And I'm going to move down to, yes.
Can you hear me? This is Mel.
Yes, I can hear you.
Okay, sorry, it took several times to unlock. Anyway, my name is Melinda Spooner, and I am currently a graduate student at OSU in the College of Public Health and Human Sciences. Sorry, my dog is barking. Anyway, I just want to let you know that, this vaccine and mask mandate for healthcare workers extends well beyond the hospital, it extends into the public health field. Likely affecting people like me who are trying to finish their graduate program in human sciences. And what it has done to me personally is it has forced me into houselessness. I no longer have good working relationships with my advisor, which I am very upset and sad about. It has isolated me from my peers. I am no longer able to have direct conversation with anybody because I can't meet with anybody in person. I am deemed a danger to the university population. And it must be understood that in public health, we are taught about public health ethics, and nowhere is a forced vaccination, forced masking in line with human subjects ethics at all. And we are not test animals. We are not research animals, and we should not be treated as such. We are human beings. Thank you.
Thank you. The next phone number is, it ends in 7136. We will enable your microphone, so you can please unmute yourself by pressing *6 to provide your name and testimony.
Hi, my name is Harry Sanger, and I'm here in Eugene, Oregon. Early on, we had a protest at Peace Health where hundreds of people came out and supported the healthcare workers that were losing their jobs because of mandates that appear to be in violation of the Nuremberg Code. I don't understand how you can coerce a treatment through threat of employment that's a unapproved experimental mRNA shot. And so that doesn't make sense. But I've been listening to today's testimony and last week's testimony, and I've heard hundreds of Oregonians speak out against mask mandates and vaccine mandates. And to me, the will of the people is resounding. And if the OHA continues to ignore the will of the people, you are operating with an illegitimate authority. So please, look in your hearts, look at the people around you, see the damage that you have done to our state, and stop it. Stop doing any more damage, or we will be looking to hold you accountable. And I think the people have spoken, you've heard it, and please show us that you have heard our voices. Thank you. Bye.
Thank you. I'm going to move on to Ibra Taher, who hasn't spoken yet.
Hello, can you hear me?
Yes.
My name is Ibra Taher. I'm from Eugene, Oregon. Long-time Oregonian, and it is sad what we witness in here in Oregon. I'd like to remind you of the Bioethics Convention of the UNESCO in 2005 and read some of it. Any preventative, diagnostic, and therapeutic medical intervention is only to be carried out with the prior free and informed consent of the person concerned. The consent should, where appropriate, be expressed and may be withdrawn by the person concerned at any time and for any reason without disadvantage of or prejudice. In subsection 3, in no case should a collective community agreement or the consent of the community leader or other authority substitute for an individual's informed consent. So what we are witnessing right now is a direct violation for the ethics of the Bioethics Convention of 2005. And not only that, what we're seeing is an attack, a direct attack on our liberties. Our medical freedom is being eroded right now. And we are talking about rights that are basic to humans. We're not talking about only Americans, we're talking about humanity. This is what we have inherently been violated to. Should I continue?
Well,
I strongly oppose these vaccine mandates. They are not scientific, they're not logical, and they are in direct violation of the ethics and the human rights. Thank you.
Thank you. We'll go back to Rich Swingle for one more additional minute.
Thank you. I found those quotes, and so I thought I'd use this extra minute to read those. These are from the London Telegraph, citing scientists. In March 2020, the government was very worried about compliance, and they thought people would not want to be locked down. There were discussions about fear being needed to encourage compliance, and decisions were made about how to ramp up the fear. The way we have used fear is dystopian. Another said, we have to be very careful about the authoritarianism that is creeping in. People use the pandemic to grab power and drive through things that wouldn't happen otherwise. And now 7,200 doctors and scientists have signed a declaration accusing COVID policymakers of crimes against humanity. I think suicides have been mentioned. They're up 75,000 in America, directly linked to the pandemic scare tactics. And since I have a few seconds left, I'll read 2 points from the Naked Communist, 45 goals of the Communist Party USA that apply. Discredit the American Constitution by calling it inadequate, old-fashioned, out of step with modern needs. Number 32, support any socialist movement to give centralized control. Thank you.
All right, we have completed our list of people who signed up to testify and any additional attendees that wanted to provide testimony. So I'm going to go ahead and close this hearing. Please remember that we are taking written comments until 5 p.m. today at publichealth.rules@dhsoha.state.or.us. And I assure you that the agency will consider fully all written and oral testimony received. The hearing is adjourned. Let the record show it is 4:39 on January 24th, 2022. Thank you.
Thank you, Brittany. You've been a trooper. I hope you get better work.